I want to take a moment and let Carla and Kelly introduce themselves. And if you wouldn't mind, Carla can start off by sharing a little bit of your background and what you do at your organization. So take it away.
All right, good morning. My name is Carla Stevens. I have been a dietitian here at Aurora Medical Center, Manitowoc County in Two Rivers for almost 17 years. And what I do here at the hospital is a little different every day. I'm able to do some inpatient work and outpatient work, and I'll explain that a little bit in just a few minutes. But how I found the career of a dietitian, when I was in high school, they didn't do these neat little presentations where we could learn about different careers and explore them. I knew that I wanted to do something in the medical field. I wanted to help people work in a hospital or a clinic, but I did not want to be a doctor. I didn't want to be a nurse. So I went to UW-Stevens Point for my college education, and I took an introduction to medical fields type of a class. And that is where I actually learned about being a dietitian. There, I got my undergraduate degree in dietetics. And in order to become a dietitian, you do need to take a variety of classes, which we will also discuss in just a few minutes. Kelly's going to help me out with that, and do an approved internship. So I did my internship at UW Hospital in Madison, which was a year-long internship. And when I was through with that, I was able to sit for the dietitian exam, which is required for all registered dietitians. And after completing that, I started my job here at the hospital. And every day, like I said, is a little bit different. I take care of inpatients here in the hospital, visiting with those that I can. Practicing now is a little different due to COVID and all of the precautions. As you've noticed, we're both masked up in here because we're in a small office and we're not able to remove our masks with the hospital's requirements. Seeing patients, finding their likes and dislikes for food. We oftentimes will calculate their nutritional needs, finding out calories and protein. If a person is in need of nutrition support, meaning that they need nutrition either through a feeding tube or nutrition that goes right into the vein, we are assisting the doctors and nurses with calculating those needs to make sure that they are able to get enough nutrition. We will send nutritional supplements. You probably heard of things like Boost and Ensure to make sure that they are getting the nutrition they need that way as well. Another one of my jobs here at the hospital is to work with the outpatients. Outpatients are people that want to come in for one-on-one counseling to learn about heart-healthy diets, weight management, whether they want to lose weight or gain weight. We work with our cardiac rehab patients, giving presentations to them, also doing presentations like this to you today. And I also have the opportunity to work at our outpatient cancer clinic, working with oncology patients. When people are going through chemotherapy and radiation, they may not be eating very well, so I'm able to help those people as well. That's one of the great things that I like about being a dietitian. I can work in a lot of different areas on any given day and help people in different ways. So I have definitely enjoyed being a dietitian and see myself being one for many years to come. And I'm going to turn it over to Kelly and let her tell you a little bit about her journey to being a dietitian.
Awesome. Thanks, Carla.
I'm Kelly Latursky. I have a pretty similar path to Carla to some degree as how I got to where I am today. I've been a dietitian for over 13 years now, and 11 of which I've spent with Advocate Aurora as a clinical dietitian. Prior to that, I had, I think, about 6 years of experience in long-term care or acute, subacute clinical dietitian experience. And I also worked for a university working with the dietetic internship in the past. But how I got there, I didn't really know what I wanted to do after high school. So I went to a 2-year college locally at UW Manitowoc, which is now, I believe, UW Green Bay Manitowoc campus. So I went there for 2 years, got my associate degree of arts and sciences. And it really wasn't until my sophomore year there that when I really had to figure out, well, what am I going to finish going to school for? I actually worked here in the hospital in the food service department and my manager, my boss, supervisor was a dietitian. And it got me to think, I wanted to work in the healthcare field. I wanted to help individuals, but I didn't necessarily want to have so much hands-on. I wanted to interact with people, but not necessarily do, like working with blood or, like physical things like a physical therapist might do. Then it's like, well, hey, a dietitian sounds like a great job. It combines, my love of science with the human body, with eating well and how you can influence that for your overall health. It was then I decided to go to the University of Wisconsin Green Bay. I completed 2 years there, got my bachelor in human biology with an emphasis in nutritional sciences. And that allowed me to apply for a dietetic internship, which I also did through the University of Wisconsin Green Bay. And that was about a 9-month program where we got to dabble in different areas of the dietetics world. So clinical was a big portion of it. We also looked at school food service, private practice, sports nutrition, pretty much everything to kind of get a feel for what I wanted to do. And that internship pretty much solidified that I wanted to work in clinical nutrition just because it involved math and involved health and the human body. So after that, I actually went on to get my master's degree in nutrition, and I went to UW Stout for an additional 1.5 years, and that allowed me a few different job opportunities with teaching that I had done in the past. But after that, well, in between there, I should say, I did sit down to take the RD exam, which you are allowed to after you do complete the internship. And ever since that, that's kind of got me to where I am today and where I'm working now.
Awesome. Thank you. So I am going to be practicing the skill we just talked about of active listening, trying to listen to your answers and formulate questions while also taking questions from the chat box. So students and teachers, if you have questions, please enter them in the chat box. One question that I have is, working as a registered dietitian, what you thought it would be, or is it different than what you expected?
I would say, to answer that partially, that it's definitely evolved. Like I mentioned, my response of how I got here and not necessarily wanting a hands-on career in the healthcare field. At first, when we were in our internships, we really didn't touch patients, but in the last, would you say, Carla, 5 years or so, we've really gotten into what's called nutritional focused physical assessments, or NFPAs as we abbreviate them. And basically, prior to COVID, we would assess patients by feeling different areas of muscle and fat tissue on their body. And that is one indicator, along with, if you see like thinning hair or changes on your nail or changes in your skin. We had to learn after we completed school how to do those things that we learned about in college, but how to really apply them. And we use mostly the muscle and fat tissue assessment. We use that, looking at weight loss, if people have any wounds, and we're actually able to help diagnose people with malnutrition. And that helps with like hospital coding and billing and things of that nature. So we weren't once touching patients, but now prior to COVID, it was an active part of our job. So we kind of had to get used to that, but it's really a cool thing, like to actually feel like severe muscle loss in a different region. Like the eye-opening thing is like, oh, so that's what that is. Like you see pictures in textbooks, but it's different once you actually feel it and do it. So it's kind of cool that we've gotten to learn that after the fact.
Yeah, that's awesome. So I'm going to try and start kind of stay with the education path for just a little bit and answer questions or get questions around that. We already had a bunch of questions coming in. What is the schooling that's required? And I think, Carla, you might have had a slide that showed something with schooling.
Yes.
Yeah, if you want to talk about that and maybe what classes, if there's any helpful classes they could take in high school to look at it or prepare for it, and then college as well.
Definitely. There are a few different routes that you can take from high school into becoming a dietitian. One of the most common ways is getting a 4-year bachelor's degree from an accredited university or college. There are plenty in the state of Wisconsin, but certainly you can branch out and go to many schools. I know, for example, where I went to school at UW-Stevens Point, my degree is actually in dietetics. Whereas if you go to UW Green Bay, it is called
human biology with an emphasis in nutrition.
So you can have different ways of earning that degree as well. This is something new that since I have gone through school, starting in the year 2024, it will be a requirement for dietitians to also have a master's degree, which is currently not a requirement. In that master's degree, you can either finish your bachelor's degree first and then go on to a master's degree, which does not actually have to be in nutrition. It can be a master's degree in a different area that you might be interested in. And you can do that in conjunction with a bachelor's degree. They are working on that right now in having to get all of that education done at one time. It is still going to be required that you do an internship or a supervised practice experience. And those internships are also available in Wisconsin and in all other states. They range from, some of them are 6 months long, some of them are a year long, some of them are 18 months long. And they focus on if you have a specific area of nutrition that you want to go into, whether it's clinical. Some people want to focus more on community, being a community dietitian. Well, maybe they work with WIC or at a grocery store. You can kind of pick and choose where you might want to focus your internship on. And when you're done with your internship, you have to pass a national examination administered by CDR, which is the registration for dietitians. Every 5 years, we do need to keep up with continuing education, as is the same for any medical career. You have to stay up to date with current guidelines. And for dietitians, it's 75 credit hours every 5 years. That was intimidating to me. I know when I first found out about that, I'm like, oh my goodness, I thought my schooling was done and now I have to do these extra credit hours. But they are easy to come by. A lot of them are online, or you can go to conferences and you can definitely choose what interests you. So I would say that's definitely not a deterrent. They're easy to earn, and they're usually fun to learn about. If you're someone that wants to get additional certification while you are a dietitian, you can see those listed there. They're specialized practice areas that you study and you take an exam for, also to kind of continue your education. If you like to work with kids, you might want to get a pediatric certification. Renal nutrition would be someone who maybe is working with kidney failure patients, or maybe a dietitian that specializes in dialysis. Sports dietetics. We actually had an intern recently, and he works for the Packers. So that's pretty cool. Oncology, which is cancer nutrition. Gerontological, which means care for elderly patients. Nutrition support, I mentioned before, for people that deal with a lot of those on tube feedings, or parenteral nutrition, which is the nutrition that goes right into the vein. And diabetic education is a specialty, which Kelly is working her way through to get certified in diabetic ed. Those are not required additional certifications, but they are there for people who want to branch out a little bit.
Wow, that's great. You had mentioned they're going to change it to require a master's, and you said it doesn't have to be in something related, or it has to be in something health body related. Do you know?
I have heard that people might want to get a master's degree in something like public health, or
Okay.
Or maybe
business
or
administration,
counseling or something like
yeah,
that.
so many opportunities and routes, and I don't even fully know what that may all be now, because it's still kind of new to us, and we personally won't have to go through it. But yeah, even with that change, people going into this career as a dietitian now, often it's like a second degree for them, or it's an adult returning back to school and they have a degree in accounting and they went back, but there's so many different ways that alternate degree can be a benefit to being a dietitian in any realm, really.
Sure. What about going back to high school? Would you say there's anything students could do now, or any classes they could take? We have a slide on that. Great. Oh, look at that.
Yeah, we do. I just have to get
Awesome.
to it. Let's see, two more. There we go.
Pretty much self-explanatory. Anything for college prep, of course, is going to be good. Things that work on home economics. One course I had to take and you had to take was food science. So we learned how bread rises and things like that, how to make a cake. That was just as important as A&P, anatomy and physiology, learning how the body functions, so you can and how different disease states affect your body, and then how, of course, that translates into nutritional needs is very important. Chemistry goes without saying, statistics and probably any kind of math really, and it's pretty much simple math we do. Like if we're calculating a tube feeding, it's just like addition, multiplication, that sort of thing. But yeah, health, obviously, promoting health, and economics, if you're involved in ordering for food service departments or schools or things like that, like really knowing how to budget and things like that. Those are all good places to start for courses in high school.
Wow, that's awesome. We might have to get a copy of this so we can forward that on to students. It's a good thing for them when they're.
Dietetics is really science heavy, which I think people don't expect. You take a lot of chemistry and a lot of biology. I think I was like 1 or 2 credits short of having a chemistry minor.
Yeah, so that's actually what attracted me to this position, just because I loved my A&P class at UW Manitowoc back in the day. Like it was so fascinating to me.
I love it that you can go to a 2-year and then go on and finish up at a 4-year, especially because a lot of students now are looking at ways to pay for school. It's a great alternative, maybe to start a little bit slower and see if you like it. Okay, let's jump into the actual position of being a dietitian. And I know you both touched on it a little bit, but we've had a lot of questions come in towards this. Explain a typical day, or what, every week, what a week would look like, what your hours are, the type of setting you're in. We're getting a lot of questions around that.
Being a dietitian is actually pretty flexible. I do work full time, and Kelly works part time. So it's on a daily basis. I would say I come into work every day, or we come into work every day, and we look over the list of patients that are here in the hospital. When a patient is admitted, they are asked a few nutrition questions. They are asked if they have lost any weight, if they have had any poor appetite, and those 2 questions will trigger us in our office to say, hey, this patient might have some nutritional needs. So that is one way that we receive notification that there might be a patient in the hospital that needs some nutrition help. We also see patients that may have lost a lot of weight in a short amount of time, or we may see them if they are on any kind of a specialized diet. If someone comes in and they're on a very low sodium diet, and we're watching how much fluid they take in, that affects their heart, we will visit with them and give them some diet education to make sure they have that before they go home.
We're consulted for wounds. If they have a wound that isn't healing, nutrition is very important for that. So we'll give recommendations in relation to that. Carla alluded to the nutrition support aspect. So obviously if people intubated, hooked up to a breathing machine, they're not able to take in food orally. So that's when we become even more so important, because we can give nutrition support to those patients to help them meet their nutrition needs, because that's the last thing you want on top of an illness in the hospital, to become malnourished because you're not eating. So we're a crucial part of the interdisciplinary team here at the hospital.
Yep. And we do work one-on-one with the nurses and the doctors and the pharmacists.
Speech therapy.
Yep, speech therapy. So definitely part of the healthcare team.
Do you help the kitchen people to prepare menus for the week, or is it only on a case-by-case, patient-by-patient basis?
We have a pretty slick system in place here that's developed over, like, both when her and I started a long time ago, it wasn't the case. We had patient menus, and diet clerks are going up to the floor having people select menus. It's pretty much like room service now. Patients can call down if they're able to. If not, nursing can help, or we send a standard tray. We have different nutritional requirements for their standard tray, so they need a healthy diet. But for the patients that are able to select, of course, if they are on a therapeutic diet, so if we're watching carbohydrates because they have diabetes and we want that to be consistent for intake for blood sugar control, or like Carla said, low sodium, any kind of altered diet, even textured altered diet. So someone doesn't have teeth, they need softer foods to chew, or can't swallow liquids, so we need a different texture or consistency, excuse me. But basically then that patient will call down to our kitchen and they will place the order. The diet clerk or lead will take their order, and the computer system will tell them, like, hey, you've met your goal for sodium or fluid or carbs, or you can't have this because it's too hard to chew. And they figure out there on the spot what they can have. Sometimes they need to get a hold of us, and if this person's going over in their carb intake, is that okay? Or they say they can chew carrots, is that okay if we can send that out? and we can, work together, figure out what's most appropriate, on a case by case situation. But for the most part, it's figured out for us with the computer system, and we have all of our food, everything that comes in from our food service providers is entered into a nutrition database, and then it can easily calculate that and pull that up if you click on a sandwich or mashed potatoes or apple juice, whatever it may be.
Yeah, so we're not in the kitchen cooking.
No.
we're not writing menus for people. We're
Sure.
really doing more of the one-on-one patient care.
Yeah. So speaking of that, you're in the hospital setting. There are other types of settings. And one of them, we had a student ask about what is the difference between the hospital setting and the clinical setting?
I would say hospital setting, the patients are acutely ill. So they have, they're having more of a chance of becoming malnourished or already being malnourished when they're here in the hospital, because most of the time when people aren't feeling well, they're also not eating very well. So I would say, that it's a little bit more urgent that their needs are being met. In the clinical setting, as for both of our outpatients, patients are feeling well. They're ready to learn about their diets. We do more one-on-one counseling with them. So I guess, I don't know if that answers the question exactly.
Sure. Sure. And you had mentioned before too, the different certificates that you can get beyond the actual education, right? Sports nutrition and pediatric nutrition and all those kinds of things. So those are other avenues, I would imagine, that you could take on in a clinical setting, maybe specializing in pediatric nutrition.
Mm-hmm. I know when I first started here, I also worked at our dialysis clinic, and I was just helping out there until they filled the position. But had I stayed in that position long term, I probably would have went on and got a renal dietitian certification. And I also could do the same working over at our Vince Lombardi Cancer Clinic. I only work a few hours over there a week. But if I were working in that realm full time, I probably would obtain the oncology certification.
And that's kind of how I am right now with diabetes education. You need to work so many hours in that area. And on top of that, get so many continuing education credits in that area of diabetes. And then you are able to sit for the exam. So if you are working in that area, or any of those areas on a regular basis, there's definitely some benefit and or eventually a requirement. You don't necessarily need to, at least like it is for me now, to be a certified diabetes educator. You have to start somewhere and work up to that. So
okay. Yeah, Kendra just kind of asked that question. Can you do both clinical and hospital dietetics at the same time? And what you're saying is yes.
Yep. Mm-hmm.
Good to know. Looking at the career in general, Carly wants to know, what are some pros and cons of the career? And I guess that might fall in line with the other question of, what's your favorite part and your least favorite part?
I would have to say that being a dietitian is very friendly to family life. It's pretty flexible. I'm able to adjust my hours accordingly. And now, especially with COVID, both Kelly and I both have young children at home. So being able to manage some work-life balance, we've incorporated a lot more virtual things such as this. I've been even doing my outpatient visits virtually, which allows me a little bit more freedom there. So hours can be flexible. I love being able to work one-on-one with the patients. That's definitely a plus. I feel like I'm really contributing to their care. And we know how important nutrition is now for people to get well and be healing. And especially in this era of COVID, that dietitians are super important for nutrition support and getting people the nutrition that they need.
But I agree with all of what she says for the pros and everything. Just being a real people-oriented position where you can interact with them usually, and teach them and help them live better ways. And then when you get follow-up and you are able to see them, sometimes some patients are admitted on a regular basis in the hospital world that we get to see how they're doing. In the clinic outpatient world, we sometimes see that too. But that's probably the best pro, I would think. But I know you asked cons too. I think Carla will agree. would be having to work sometimes holidays and weekends. We are on a rotating schedule with another hospital nearby, but we do have to give up some time on the weekends and holidays to make sure that all patients' needs are met, which is important. So you just kind of work through it, and we have a good team together that we can, if we absolutely need it off for a particular day, we can always switch. But that I could guess would be seen as a con potentially.
And
Sure.
that's if you work in a hospital. Obviously, the hospital never closes. For other areas of dietetics, if you work in a clinic setting that they may not be open on weekends or holidays, or in a school setting or grocery store, then you'd have a little bit more freedom in not, probably having to work holidays and weekends. But it just kind of depends on what your passion is and where you feel like you want to aim your care for being a dietitian.
Sure. Speaking of teamwork, how many people do you work with in your team? How big is your department, or, how do you work? Do you have people that are not 4-year degreed in your department?
Well, our hospital is relatively small. Kelly and I are the only dietitians here. And like we mentioned before, we have like 1.5 full-time dietitians between the two of us. We also are grouped with the food service department.
30.
I'd say there's about 30 people that work in the food service department. But in the realm of Advocate Aurora being a system, there are
another like 200.
Yeah, there are around 200 dietitians in the system. So if we need help, I know, for example, today I'm actually helping out in Grafton virtually with their patients because they're really busy and they need some help. So we have the opportunity to be able to assist. And we even, due to COVID, we have been allowed to work across state lines and help out in Illinois as well.
Oh, wow. Okay. Kendra would like to know, knowing that you work on a team, especially where you work, can you finish early, or do you have set hours like 9 to 5?
We have set hours. We would like to have a dietitian available between 8 and 4:30 is what our scope of practice states. But I know I have left early, and I have taken my laptop home, and I can connect from home, taking care of some things on the phone. I have had to work at home when my kids have been at home sick. So it is a flexible in this particular position that we can work from home if needed.
Yeah, that's great. Now, obviously you're both women. Do you find a lot of men are going into this field, or is it predominantly women?
In the last couple of years, I would say, at least when I was going to college, there were a couple men that were in my classes. I would think that number is growing. I don't know how much, but it's certainly a career that, there's no gender requirement. Anybody can do it that would like to. There's so many different avenues to go in that, if it interests anybody, they should be able to do it.
Yeah. Actually, I missed a question back on the education part, or maybe more on that end. Is there a difference between a registered dietitian and a registered nutritionist? And that brings to mind, I think you had a slide.
So historically, we have been known as registered dietitians, or abbreviated as RD. How many years ago that was that? In recent years, our professional organization in the country, the Academy of Nutrition and Dietetics, recently changed the designation for us. So if we choose, we can be known as registered dietitian nutritionist. So if you have either used the RD or the RDN credential, that means you have went through the college coursework, you went through an accredited internship program, you sat for the exam through the Commission on Dietetic Registration, and you are an RD. So you went through all that appropriate schooling for that. A nutritionist is somebody that necessarily hasn't done all that stuff. So they tried to change the terminology or our title to help eliminate some of that confusion for consumers out there, so that we are the nutrition experts, as opposed to someone who might have taken a college course or two, or got a certificate in nutrition, or something that isn't through the accredited path that we have done.
So you
Sure.
really want to see the registered dietitian or registered dietitian nutritionist, not
Okay.
the nutritionist alone.
All right. I was just thinking, as you were talking, back to the 2-year versus 4-year, is there a 2-year food related or nutrition related degree that either of you know of?
I'm not so familiar with it off the top of my head, but in some larger cities and larger hospitals, there's a need for what are called dietetic technicians or DTR, they're registered dietetic
Oh, okay.
technicians. And that they basically would be like the people that would be helping with food service and making sure diets are appropriate. But that I think is a 2-year
I
degree.
think so. And they have to do a little less continuing education,
Yeah,
but it's still required.
But it is definitely an option if the 4-year or future master's degree that will be required is if you're not looking into that much education.
Sure. Okay, students, just so you know, we are getting close to the end of our time. I'm going to share a survey in the chat box when we are done, if you would click on that and fill that out. We did have a comment from a young lady, Emily. She works with a GI doctor and a dietitian because of some health challenges herself. And so she's working with many issues that eat up a lot of her calories. So she just wanted to point that out. And I think that's important for students. We do see a lot of different health challenges today. Would you agree? In younger people that might cause them to want to look into being a registered dietitian. Do you see that in the hospital? Do you see a lot of young people?
In our hospital specifically, not really in the hospital, but I see a good amount of younger people trying to make changes in their diet for just that reason. Trying to improve their health through diet as the first means rather than, looking for medications. There's a lot of younger people that want to find healthier ways to manage conditions rather than medication. So there are some specialized diets out there that are meant to treat medical conditions, and we can certainly help people with that when they have questions.
Yeah.
That's something I do on the outpatient side. Yeah.
Okay. And you had touched on this a little bit before, but how do you stay on top of, I mean, the science of food itself is changing so fast and how it affects the body. How do you stay on top of everything that's coming out?
The continuing ed for one thing, but then also our network of dietitians, especially in the system. Like, again, we were going back to COVID and this pandemic. In the beginning of the pandemic, a lot was unknown of, certain things, and some parts of nutrition were not as heavily researched yet, but we at the beginning of the pandemic, all pulled together, found all the current research and evidence and information out there, and then compiled that and made that available to all dietitians throughout the system. So we've done that with not only that, but other areas like, if refeeding syndrome, or if someone needs bariatric nutrition, or diabetes, like we have this nice resource available to us that, and then we make sure that it's up to date every couple of years and have different subgroups that look at it and look for the current research and information to make sure that we're providing the most up-to-date nutrition care based off of what we have available. So that's kind of how we do it for a lot of our stuff. And then also we use the Academy of Nutrition and Dietetics nutrition care manual. So it's kind of already done for us on a lot of things. There's certain areas that we may need more information. So that's kind of what I was alluding to, but the bulk of our information and then the information that we educate patients on can be found through that resource for us.
Mm-hmm. And the Academy of Nutrition and Dietetics is, what we go through mostly for being a dietitian, and they offer a lot of continuing education. We get a journal every month through that membership where, we can read about the research and, group together with other dietitians and talk about that research to learn more about it.
Yeah, that's awesome. We do get a number of inquiries from students into the genetics and nutrition. Do you know if there's a branch of being a registered dietitian that can actually do research, or I guess you'd stay at a university for that?
Mm-hmm. Yep, there's a branch just for research dietitians. Definitely, okay. I worked under one during my internship. They do fascinating things. People might be looking into, how food affects different cancer treatments, and what varying levels of fat can do for certain diets, and making improvements in cholesterol levels. So definitely, you can focus on the science portion of it and really go into nutrition in that area as well.
Okay, great. I have two last questions. One of them is from Sahara, I apologize if I butchered your name. She is wondering what the typical salary range is. So maybe an RD right out of school passing the test to maybe one that has a master's later on. Oh, great. We have a slide.
We have a slide.
I have some information.
It's not
dated.
super up to date. This is the most recent that we have out there. So this would be kind of the expected
Okay.
national range. You know, of course, if you're living in a bigger city, you get paid a little bit more.
Sure.
That's kind of a range. I would have to
Perfect.
say being a dietitian is not the highest paying job you can get in the medical field, obviously, but it has allowed, allowed me, you can have a vehicle, you can purchase a house. My husband and I, we were able to support having children on a salary. So it may not be the top salary as like a nurse or a doctor, but it is definitely a comfortable living, especially as you progress.
Being a clinical dietitian is probably one of the higher paying jobs in the dietetic world too.
Okay. Okay. We did have a question before from a student. I apologize. I skipped over it. If you had to do it again, would you choose the same path?
I love working in the hospital. As I have been a dietitian, it has opened my mind to a lot of other healthcare fields that I hadn't considered when I was in school. Just being able to work with, one-on-one with physical therapists and the pharmacists and speech therapy. So I think had I done this again, I would choose dietetics, but I may do an emphasis in another area because there are so many different areas of nutrition that kind of go along with other healthcare careers.
Yeah, I would agree with her. Like just working in the hospital, I didn't realize like a speech therapist would be involved so much in nutrition and helping people eat safely again. And that's something that might have intrigued me more had I heard about it when I was going to college. But even looking back on my internship and all the experiences, like to this day, I kind of wish I could dabble into every little thing because there's just so much. It's all very interesting and exciting to me. But I do find where I'm at now in this clinical world, I still kind of get that to dabble, not maybe in like school for food service, for instance, but yet I'm going into all these different disease states, or I can work in an inpatient or outpatient setting. So I still get that variety. So I think I would probably do it all over again for sure.
Oh, that's good to hear. Okay, last question. If you had to go back and give your high school self some advice, what would it be?
Take more college prep courses so that you can get them out of the way when you get to college, so that you're not having to worry about the basics. Right?
I think, I mentioned this already before, is do your research on different fields, because when I got to college, I had to do an extra semester because I was undecided which road I wanted to go. I had considered being a physical therapist, and it was a different science that I had to take. And because there's so much science, because I waited to take the course, I ended up having to do a whole extra semester of school. So now is the time when you're in high school to, look into all the different careers that you might be interested in, and think about it before you get there. Just if you're trying to streamline things, that helps.
Yeah, that's awesome. And it's cheaper to do it in high school, essentially free, right? In college, it costs you more money. Like you said, you end up another semester. Well, Carla and Kelly, thank you so much for sharing your experience with us. Carla and Kelly, would you mind emailing me the presentation? Could we share that out with students?
Absolutely.
Definitely.
Sure.
Oh, perfect. All right. So students, look for that in your email, and we'll get that out to you. Again, Carla and Kelly, thank you so much. This was awesome information, very fascinating. And also students, don't forget, if you want to continue asking more questions, you can log into your Zello account and look up the career of registered dietitian and look for the huddles in there, and you can ask more questions. So once again, ladies, thank you very much. We hope you have a great day and enjoy, everyone.
Thank you.
Thank you.